I'm Dr. Garrett Rhoda. I created this video to give you a little information about cataract surgery. I'd like to begin by reviewing the anatomy of the eye. The eye is set up a lot like a camera with lenses in the front of the eye that focus light to the back of the eye. The back of the eye is called the retina, and it acts like the camera film of the eye. The lens we're concerned about is our natural crystalline lens. It sits behind the pupil. The lens grows throughout life and protein is deposited. This protein can become cloudy with time. This cloudiness is what causes our decreased vision and the symptoms commonly associated with cataract surgery. Now that we've talked a little bit about cataracts, I'd like to talk about cataract surgery, like when it's appropriate to be performed, how we perform it, and some potential complications. Cataract surgery should be considered when you notice a decrease in your vision, or if you're no longer able to do the normal activities you like to do. Naturally, this is going to be different for everyone, but if you find things like driving or reading are becoming more difficult, then you should consider cataract surgery. As far as I know, there are no non-surgical options for cataracts. Cataracts only get worse with time. It's normal to be anxious about your cataract surgery. That's why we offer IV sedation for relaxation. We use topical anesthetic drops to numb the eye and make it comfortable for surgery. If we're doing both eyes, we typically do the eyes 1 to 2 weeks apart. So now I'd like to talk about how cataract surgery is performed. A lid holder is placed in the eye that keeps the lids open for us. This gives us a good view of the eye, where we make small incisions at the edge of the cornea. We then use an ultrasonic vacuum to take the cataract out. The lens itself is a lot like an M&M. It has an outer candy shell and a chocolate center. That candy shell is called the capsular bag, and the inside part, the chocolate, is the cataract. So we make a circular window in that candy shell, and we use that ultrasonic vacuum to suck out the chocolate. We put that lens implant inside the capsular bag, or that candy shell, which really is more like a sandwich bag. And as we heal, the edges of that sandwich bag scar down around the lens, which holds the lens implant in place.
The lens that we place comes in different flowers. There are many types of lenses and lens manufacturers currently. I want to start out by saying these lenses are all man-made, and none of these lenses I'm going to mention can compare to the natural lens we have had when we were younger. The standard lens is most often used is called a monofocal lens. Monofocal lenses correct vision without glasses at one set zone. The 3 zones we can set the eye to are distance, intermediate, or near. Distance is about 6 feet to infinity. Intermediate vision is about computer length, and near is reading. Typically, the lens is set to correct distance vision, meaning your best vision will be in the distance, and you will need glasses for near activities. Sometimes the monofocal lens can also correct your near vision. In this instance, you would need glasses for the distance. Choosing the target of your vision depends on your lifestyle and visual preferences. If you're somebody who enjoys activities like reading, knitting, or using your smartphone frequently, you might consider optimizing your vision for near tasks. On the other hand, if you lead an active lifestyle and prioritize distance vision for driving or outdoor activities, we can target for that instead. Technology in ophthalmology is advancing rapidly, and there are several exciting technologies you can choose for your cataract surgery. Unfortunately, insurance does not cover the cost of these new technologies. I will mention some of these options now, and if you're interested or would like some more information, please let us know. I'll begin by talking about your options for the intraocular lens implant. If you have astigmatism, a common refractive error, it means that the cornea has an irregular shape. This irregularity can cause blurred or distorted vision at all distances. Toric lenses are specially designed to correct astigmatism. During cataract surgery, I'll precisely align the toric lens to address both the cataract and the astigmatism, potentially reducing or eliminating the need for glasses or contact lenses after the surgery for either your distance or near target. Premium lens options like multifocal or extended depth of focus lenses are a fantastic choice for patients who desire greater independence from glasses. These lenses can significantly reduce or eliminate your reliance on reading glasses or bifocals, giving you more freedom in your daily life. Even though these lenses are created to decrease your reliance on glasses, we still cannot guarantee complete glass independence. Another innovation is femto-assisted cataract surgery. This state-of-the-art procedure employs a femtosecond laser which operates at an incredibly fast speed with exceptional precision. During femto-assisted cataract surgery, a laser helps in creating precise incisions, breaking up the clouded lens, and softening it for easier removal. This high-precision approach enhances overall accuracy of the surgery, potentially leading to a quicker recovery. It is important to note that not all patients may require or benefit from femto-assisted cataract surgery. Factors like the complexity of your cataract and overall eye health will determine if this advanced technique is right for you. If femto-assisted cataract surgery is suitable for your condition, it can significantly enhance the overall precision and safety of the procedure. In addition to these advancements, I want to introduce you to a technology that can further refine the precision of your cataract surgery. Intraoperative wavefront aberrometry, commonly known as ORA, or optowave refractive analysis. ORA is a remarkable tool that we can use during your cataract surgery to measure the eye's refractive power in real time. By using ORA, I can obtain precise data about your eye's unique optical characteristics, allowing for immediate adjustment during the procedure. This real-time feedback ensures that the chosen lens power is as accurate as possible, potentially enhancing your visual outcome. ORA is particularly beneficial for patients with previous LASIK or PRK surgery, or those considering advanced premium lenses. It is essential to discuss with me whether these advanced technologies are suitable for your specific case. The goal is to customize your cataract surgery as much as possible, and these technologies play a significant role in achieving that personalized approach. With all our surgeries, and even with these advanced technology, there's typically a small amount of remaining refractive error or glass prescription. If the refractive error is far off the intended target, there are certain instances where we can perform a lens exchange, which is a second intraocular surgery, or perform LASIK to fine-tune the prescription. Generally, LASIK is a safer alternative.
All the measurements we take before cataract surgery help us decide which lens implant to use for your specific eye. I would like to mention, if you had previous LASIK, PRK, or RK surgery, this decreases the accuracy and predictability of your lens implant. So once again, we cannot guarantee to get you out of glasses. Even if we set you for a distance target and you think you may only need reading glasses, we still can't guarantee to get you out of glasses for the distance. I'd also like to mention that LASIK and cataract surgery are two different surgeries, and the refractive outcomes of these surgeries are slightly different. And part of the reason for this, and part of the reason that we can't guarantee to get you out of glasses, is we don't have control over how the eye heals. As we place the lens implant in and healing occurs over the next month or so, that lens implant can shift forward or backwards. This decreases the accuracy and is why you may need a glass prescription after the surgery, even with all the measurements that we take.
I'd like to discuss potential complications that can occur with cataract surgery. First of all, blindness is extremely rare and not likely to happen. The way it could potentially happen would be if you got an infection inside the eye. We treat this as an emergency. You would know it right away because the vision becomes very blurry. There's a lot of pain associated with it. We would work alongside with the retina specialist, and we would probably need a second surgery to clear the infection. The most common complication we see is a ruptured posterior capsule, where the capsule holding the cataract in place is damaged. Sometimes when this occurs, the cataract can fall to the back of the eye and a second surgery would be needed to remove it. There is also the possibility that we would have to use a different lens implant at a different location if the original implant does not have the appropriate support. And although rare, sometimes we are not able to put a lens in the eye at all during the original surgery, and a second surgery would be needed to place a lens in the eye. If this were to happen, the vision would be very blurry until a lens is put in place. A ruptured posterior capsule occurs in less than 1 patient out of 100. After surgery, you can develop swelling in the retina. This is referred to as cystoid macular edema, and it can affect the center of our vision. This can drop the vision down to very blurry levels. Most of the time, this edema will go away on its own, but can take months. We typically give a steroid injection to the outer coat of the eye that helps speed the recovery process. It is not a common complication, but it does occur about 1 out of 100 patients. Another possible complication is a detached retina. This is a serious complication, and if this were to happen to you, you might experience a dark curtain accompanied by floating spots or flashing lights, we would need to send you to a retina specialist to have this repaired. In most cases, it can be corrected. Retinal detachments occur in less than 1 out of 100 patients. Sometimes we can get unwanted reflections or shadows off the implant itself. This is called dysphotopsias. It is possible to get a little reflection or shadows in our peripheral vision that look like a dark crescent. Sometimes these go away on their own, but sometimes they're permanent. We do have to accept this possibility as it is a man-made device. Also, it's possible you might experience corneal edema or swelling of the cornea, which is very common on the first day or two after surgery. Please keep in mind that cataract surgery fixes cataracts. So if you have a pre-existing condition, such as macular degeneration, macular scar, or diabetic retinopathy, it is possible that your vision may fall short of 20/20. Once your cataract is removed, that's permanent. It will never come back. However, there is about a 50-50 chance that you'll develop a little protein film that can form across the posterior capsule, which usually takes 1 to 2 years. However, it is very simple to correct. We use a laser called a YAG laser. The YAG laser is a no-touch technique where we shine the laser through the front of the eye and it opens the posterior capsule. Once that's done, it's permanent. So it's a very simple cure for that problem. Please keep in mind, due to this short video, this is not a complete list of complications and others can arise. Let's talk a little bit about what's going to happen on the day of your surgery. So on the day of the surgery, you will need a driver. Because you'll be given some sedation, you may be drowsy afterwards. Also, your vision will be blurry in the surgical eye. Guidelines as far as eating or drinking will be given to you in writing, and this depends on the time of day you're having surgery. We do all our surgeries under IV sedation, so you will not be put completely unconscious, but you will be nice and relaxed. And if you're very apprehensive, we can actually make you very drowsy and sleepy while the surgery is taking place. You will be in our building for about 2 to 3 hours from when you set foot in front door until you're actually leaving. The surgery itself takes about 10 minutes, and after the surgery, there are 2 main precautions I'd like you to avoid. One is rubbing your eye vigorously. You can still take a Kleenex and blot the inside corner of your eye. Secondly, we want you to use good hand washing techniques and avoid contaminated water like swimming pools and hot tubs. Showering is never an issue. You likely keep your eye closed in the shower anyways. Bending and lifting used to be a problem with older style surgeries. It's usually no longer an issue with the way we do surgery, but we do like you to take it easy for 1 week. Now, since there's no bleeding with cataract surgery, patients who are on blood thinners do not have to stop their medications unless we specify otherwise. You will be sent home with an eye patch over the eye and given specific instructions when to remove it. Typically, it'll be 1 hour after surgery. You will also be given written instructions on how to use your eye drops after surgery. When you come in on the first morning after surgery, your vision is probably not going to be perfect. You may have some swelling, and it typically takes a week or so for the swelling to diminish. Healing of each eye is very different, so we're unable to accurately predict when the vision will be the most clear. One of the most common questions I get from patients is what to do with my old glasses. This will vary from person to person. Sometimes you can pop a lens out of the eye you had surgery on, or you may find it better just to leave it in until a new prescription can be given.
I know this video contained a lot of information. If you would like to be shown where to access this video or have a copy, please ask our staff. We'd be happy to give you one. Also, if you have any remaining questions, please ask me or my staff. We want to make sure all of your questions are answered before you have the surgery. In closing, I'd just like to thank you for being a patient and for choosing our center.